My name is Kumar Narasimhan, and I head a group called Informatic Predictive Sciences. And within the predictive sciences, we have a niche group called Knowledge Science Research. And the activities we do is connecting disparate data sets, clinical data sets, biomarker data sets, and perform data analysis. We do data science activities, simulation modeling, and finally, we help the stakeholders like clinical scientists, clinical trial physicians, biomarker scientists, bioinformaticians to perform their day-to-day duty more efficiently. One current situation on digital health is there is a huge vacuum. What is needed in the market versus what is produced. So one major requirement in the digital health is that one, how can you translate a needy requirement, especially let's say for example, medical affairs is a group in the pharmaceutical industry. So medical affairs wants to make sure the medical doctors can use a particular digital health tool which can enhance their predictability. So we are looking at tools where we can put that in the hands of the physician, where the moment he puts the certain parameters in the tool, it will tell the physician that whether this particular patient is grade A, grade B, grade C, and what is the intensity of the score. Based on the score, the physician can actually co-manage cost and quality to give him the best treatment. So why how can India be unique, or if you compare with other global organizations, that we have a young talent, we have a talent set of people who are very well trained in domain expertise, plus the communication, the language they speak is we can work anywhere in the world, unlike other countries where the language is a barrier. Third thing is our community or our set of people are willing to learn and invest time. That's where we excel as compared to other parts of the people who are in other parts of the world. So the course which is currently needed is that where it can blend the hands-on training program with the domain expertise. So in the market, we have either the domain experts or the IT experts. So we don't have people who have both the knowledge together. So during this course, what happens is we can take a person with domain expertise, meaning he can be a pharmacist, he can be a medical doctor, he can be a dentist, and train them to do statistical programming or SAS programming. Or we can take the IT person who doesn't have the domain knowledge and train them with domain expertise. So this course is traded in such a manner. It is a 13-week course, and each week we talk about each module, and each module actually graduates from basics to advanced statistical programming and macrotization and all that extreme advanced programming level. We do it in 13 weeks. So in this process, it's not just data, it's not just hands-on, but it's a project-based training. The uniqueness is not be able to work with few sample records. It is actually true data from FDA, which is called post-marketing pharmacovigilance. And that data we will actually use as a training data set for our training program. Once that is done, that is it's a hand in glove. That is programming is also taught, and how the data has to be massaged, or how the data has to be analyzed, how to generate the report, what are the requirements for the FDA. Those things are taught in that, because there are 7 limited data sets. But once that data analysis is done, we are going into the clinical industry, where the study is, let's say, for example, we have a dummy data set which is called a study which is a double dummy randomized 2-period crossover study which has around 36 or 40 subjects, and those data sets which has around 30-40 data sets which actually contains PK, it can contain lab, it can contain biomarkers, and this is conducted used to use this data set to conduct a clinical trial report, and this report is generated using SAS Spotfire, so that the data visualization is happening in one hand and the reports table listings are happening in the other hand, so that at the end of the training course, people will know how to work with large data sets. People will work to get to know how they work on the small data set, and in an overall impact, how you have to manage within the clinical data intelligence standards consortium, which is needed as per the FDA requirement. One take on the talent requirement is that the education system, which is actually imparting the training, is basically oriented around completing the course, grading the candidates, and giving it the pass out. But what is needed in the industry is that people who have experience in that environment, meaning let's say machine learning or example deep learning. How do you take an image and convert them to draw some lessons? Or take the clinical data. How can you digitize them and to the code to the core to make sure that the data is available within minutes of the data made available in the system. So the gap here is that people are not adequately trained in using the tools, nor how to implement the tools so that the quality of work which can generate can be easily uh, easily available for the stakeholders for making informed decisions. The question is that what is the gap between the availability versus what is the talent which are available and what talents which are not available in industry. So my recommendation as a strategic requirement is that every institution, instead of having this 3 years course or 4 year course, one of the semester they should actually allow this candidate to go out and do a project so that he has the real time hands-on experience. So when he comes back and joins the course, so he has already a hands-on experience of a particular project where he has used the tools which are available in the market. Tools like R, tools like SAS, tools like Spotify, tools like Tableau, which are not actually taught in the academic setup. Whereas if you can send this particular student or a batch of students to a particular training institution where they are specialized in these kind of skill-oriented training programs, so that when they are graduating from the organization, they are full-fledged to get into the market, rather than at that time getting to go into the institution, getting trained, waste another 6 months to 8 months, and you get frustrated. So this is one of the strategical recommendation that as part of the curriculum, one semester has to be done outside the college. One thing which we have done is we have gone to different organizations like universities and campuses to get the most recent latest talent. And second thing is we are not putting them on the project. We are directly taking them and putting them in intensive 6 months hands-on training program. Once on the 6 months training program, we make sure that they are all acquainted with all the tools and systems and procedures and SOPs in our system at any organization. And from there, we are actually deputing them for the